It's election time this spring in Prince Edward Island, and that's about the only time that politicians might seriously listen to islanders when they come to your door and ask you what you want from their government. Now, the Binns government, with Chester Gillan as the health minister, has told us that they plan to do nothing about moving forward on the issue of legislated midwifery for Prince Edward Island. But do PEI women really want this service? Well, the ones I've spoken to do. Do women across Canada want midwifery? We're only one of 3 provinces in Canada that doesn't have publicly funded legislated midwifery services. Midwifery has been reintroduced everywhere else all across the country. So why are we left off the wagon once again? Well, our government says women on PEI don't seem to really want this service. They haven't heard from you. Well, this is the time to talk to them when they come to your door. We're not asking for something out of the ordinary here. It's right in the Health Canada reproductive care guidelines that were issued in 2000 that women should have their choice of a care provider, whether it be a midwife, a doctor, or an obstetrician. It's up to the woman and her family. It's their choice. But we don't have that choice here on PEI. The only way you can have a birth here on PEI with the government's support is in the hospital, and the majority of those births are attended by an obstetrician because you don't have any other choice. You should be able to have your birth in your home or in a birthing center or in the hospital with your choice of care provider. So it's about time that women in PEI and their families got up and asked for what women across Canada already have. We're reintroducing a service that PEI women have had historically. They've had access to midwives. We have nurse midwives on Prince Edward Island that are willing to work as midwives, but they can't until the government moves forward to give them the legislation to put that in place so that they can do it properly. Midwifery is supported by the Canadian Society of Obstetricians and Gynecologists. They feel there's a need for midwifery services. With more and more obstetricians retiring, we're soon going to face a crisis in maternity care. Who's going to be there to deliver your baby? Who's going to be there to catch your baby? The midwife is the one who's positioned to take care of normal births, and is the service that women here on PEI should have access to. There are women that have come to our group who've said they stayed in other provinces to have their babies. They didn't want to have a birth without the services of a midwife. Even if those kids come back to PEI later, we know an islander born off island isn't an islander. So let's bring those women and their families home to PEI, and let's have those babies born here in PEI with the care provider of women's choice. There's lots of evidence that shows that midwifery services are safe and healthy for mums and babies. Mothers spend less time going back to the hospital with concerns because midwives offer extensive postpartum services as well as prenatal education, offering a best start to every baby and family that they care for. We need this service on PEI, and we need you to talk to your politician about it now. You can help us by signing on to our petition directly at www.born-pei.ca. Apologies to Rick Mercer.